So there are several things that has come to my notice, but I will walk you through this step by step. Before that, kindly hit on the like button, subscribe to the channel, and anytime we come, just put us on post notification so that anytime I post a video, you'll be able to get it right on time. Now, are you having problem with controlling your blood glucose level or your blood sugar levels? When I say this, I'm talking about people with type 1 diabetes and type 2 diabetes. Now, with these two, type 1 diabetes, basically you are always injecting insulin, okay, on your belly, on your thigh, your back, etc. And when we talk about type 2 diabetes, it is when there are people taking oral medications, okay, just to control your blood sugars. There are people also, even with type 2 diabetes, and they still need insulin to control their blood sugars. Now, let me make this thing a very simple video so that you tend to understand what I'm talking about. So, anyone who is taking insulin or anyone who injects insulin, if you know someone who injects insulin, kindly share this video to the person. If you know anyone at all who is also managing diabetes, share this video to the person. I won't be going into the diabetes condition because I have other videos up there which you can check and then just update yourself on diabetes. But otherwise, if you are using insulin, this is it. There are people who use insulin and still, or up to date, they still have troubles controlling their blood sugars. The reason is this: the inappropriate nature or how you are taking your insulin shots. Most often it's either you are just injecting yourself, that is causing trauma to yourself, or you are not doing it right. Okay, I'll walk you through just a few steps to help you know how to manage this situation. Now, if you have insulin, let's say you inject yourself, let's say 20 IU or 40 IU, 60 IU in the morning, and then you inject also in the evening. What happens is on a normal day, we expect insulin to be secreted into the gut or into the bloodstream. Sorry, let me use the bloodstream to simplify everything. We expect insulin to be released by the beta cells of the pancreas. Okay, release insulin. Insulin gets into bloodstream. Bloodstream, when you've eaten and then there's digestion, there is glucose in the bloodstream, and so the insulin goes to take or binds with the insulin. Okay, the glucose binds with the insulin, and then insulin walks the glucose out of the system. That's why after a couple of hours you might feel hungry again, because insulin glucose is out of the system, kind courtesy the insulin. Now, you are injecting insulin without food. What is going to happen is you get hypotension. You did I say hypotension? Hypoglycemia. Okay, your blood sugar levels will go low, and then you might get you begin to have palpitations, sweating, dizziness. You can even go unconscious, and worst case scenarios, you can even die, which we are very scared of that, and so we don't want that to happen. Now, the other way round is when we don't take your insulin at the right time. At the right time. See, if you immediately you inject, the best solution is immediately you inject your insulin. Make sure prior to that there is food in front of you. This is the best way to inject your insulin. Make sure there is food in front of you. You inject your insulin within 5 to 10 minutes. You get on and munch your food. Why is this so? It is so because the insulin will be able to pick up all the glucose after digestion. The insulin will mount or pick up all the glucose in the bloodstream, or all the sugar in your bloodstream, take it out, and then send it to the right places it needs to be stored or needs to be utilized. Immediately you inject insulin. If there is no food, you'd realize that you are either going hypo, that is hypoglycemia or low blood sugar, or the glucose level in your blood. If you want to prick yourself again to check, when you prick yourself, you realize that the sugar levels are not controlled. So I have a patient who we have regular consultations, and it's about the blood glucose. And the blood glucose we are trying to manage, sometimes it's excessively high, sometimes it's excessively low, which we don't want the low. If it's high, at least we can give something to bring it down. But if it's low, then there is a problem. Now, if it's high, we are giving insulin, we expect it to be able to get controlled, okay, in the normal ranges. But we are not achieving this step. The best thing to do is that you need to get your food ready. Then you grab your insulin injection, give yourself the shot, and after 5 to 10 minutes, okay, or let's say 5 to 15 minutes is too much. So 5 to 10 minutes, you should be ready to have a meal. And this meal, the insulin will then pounce on it, grab it, and then there we go. That's it. You wouldn't be experiencing problems. Now, if you are someone who takes oral medication, oral hypoglycemic medications, which means diabetic medications, if you are someone who takes any medication for diabetes, this is what you have to do. The same way, if you take the medication without any food, you will go into hypo, which means the blood sugar will go low and you might cause harm to yourself. But if you are taking it whilst your blood sugar is high, then when you take your medication, you make sure that there is food also available. The insulin goes hand in hand, just like the medication. The medication is supposed to bring the blood sugar that is high to normal. And the same way, the insulin also brings it high to normal. Has this been helpful? If it has, kindly click on the subscribe button, like the video, comment on it if you have any questions about this, and you can also share to anyone who might need this. It's always a robust lifestyle with Dr. Samuel Ologo.